There's also some new hope as the CDC releases updated recommendations for gatherings. The agency now says fully vaccinated people can visit other fully vaccinated people in small gatherings. They can happen indoors without masks or social distancing. Now, this new ruling is a big step in the right direction, but experts say it's dangerous to think that we can just return to normal. Tonight we are talking live with Dr. Yealy, chair of the Department of Emergency Medicine at UPMC. Dr. Yealy, thank you for joining us tonight.
Thanks for inviting me.
What can you tell us about the new CDC guidelines for vaccinated and unvaccinated?
Well, it's a very small step towards normalcy, and it should be an encouragement for everyone to get vaccinated. It's not opening up things as we knew it 2 years ago or a year and a half ago, but it's the very first step.
Why is it now safe for vaccinated people to hang out unmasked with people who are not vaccinated?
Well, the most important thing to remember about these new recommendations is this is for people who are gathering together under two circumstances. Vaccination is complete, and that means 2 weeks after the final dose of whatever vaccine you had received, and with known people in an indoor setting. This is not for public places, large gatherings. It's the beginning, and it's a very small step of progress. And it means that not that transmission can't happen, but that serious disease is not likely to happen. And that's what the point of the vaccines are.
A lot of people get so excited, they post their picture with the slip saying that they've been vaccinated. Can you still spread the virus to others?
In theory, you can. You probably can't do it as well as you could before vaccination, but you could spread the vaccine or the virus, excuse me. And that's why it's important to choose who it is that you come in contact with. If you came in contact with a vulnerable person who isn't vaccinated, they can pick the virus up. We're not out of the woods yet until we have much more vaccination across all of our communities.
Why does it take 2 weeks for someone to be considered fully vaccinated?
The vaccine teaches your body how to respond to the virus, and that lesson takes many weeks. If you have a 2-dose injection, the first injection teaches your body, and the second injection 3 or 4 weeks later reinforces that lesson. And then you build up immunity through both circulating things and through cells. It just takes time.
Are you fearful, or have you already seen today's headlines possibly being misinterpreted?
Absolutely. The very first set of emails and questions I got is, we can go back out, we can go to restaurants, we can go anywhere without masks and without distancing. And that's not what the CDC said. That would be foolish. I don't want to see more people coming to the emergency department sick, needing breathing assistance, needing to stay in the hospital. And if we're not careful and we don't go slowly, we will see that again.
Thank you, Dr. Yealy, for your time.
Thank you for asking. Keep those masks on if you're in doubt.
Thank you.